go and see if you have back pain? A chiropractor, a physiotherapist, an osteopath, a spine surgeon, a pain specialist. There are so many different professions out there that treat these conditions. It can be quite tricky to figure out who to see. Well, hopefully this video will help you answer that question for your needs. I'm Anthony Gosh, I'm the lead neurosurgeon and founder of the Spine MDT. Please click the subscribe button to stay up to date with regular videos we post to help you understand back and spine care a bit more. Visit our website on the link below where you can get my free guide to managing your back pain. It also explains a bit about different types of people that treat it, and also visit our blog page where the videos are also posted on the channel. I've recently recorded a video on the different types of people that treat neck pain, which you might find useful. There's also a separate video on a guide to the different professionals managing back and spine disease. So who do you go and see? Well, first I'd like to break this up into acute back pain or chronic back pain, whether there are any underlying diseases, any neurological symptoms associated with it to try and help us make that decision. Well, let's take chronic back pain, pain that you've had in your lower back that's been there for quite some time. Maybe it comes and goes to some degree or gets acutely worse now and again, keeps coming and going. All of the three types of practitioners that are non-medically qualified, such as a chiropractor, a physio, or an osteopath, have their benefits. And what you tend to find is that there's an overlap of manipulations or adjustments, actual hands-on work, and also teaching you exercises to strengthen the spine. A lot of the evidence suggests that actually a combination of both helps. So there's a lot of overlap in what they do. Overall, though, it's about trying to keep the core, which is a group of muscles that surround and support your spine. So you have abdominal muscles, the oblique muscles down at the sides, lower back muscles and gluteal muscles. Try and strengthen those whilst keeping your weight down at the same time. That's kind of the long-term benefit that you get in reducing your back pain. Overall, I think a physiotherapist for sort of long-term treatment is probably better. In terms of acute back pain, when you have these acute exacerbations, whether you're used to having back pain chronically or whether it's new, chiropractors, osteopaths can do certain manipulations sometimes that can ease you from that acute episode, depending on how bad it is and how painful it is for them to manipulate you. Sometimes there are maneuvers they can do that can help ease it. So that's the hands-on stuff. But then it is important you combine it with exercises that you are taught to go off and do. No one can magically, miraculously cure you. It has to, unfortunately, a lot of it has to be the work that you put in to lose weight and strengthen the muscles that support your spine. Let's take acute back pain that's come on after an accident, say a fall from a height, a car crash, something that's had quite high impact injury. I think it's very important you do get medically checked out by seeing your doctor ASAP, either in A&E, depending on how bad it is, to exclude a fracture, something that might need invasive treatment. In that scenario, you don't want any sort of manipulations that are blindly done without looking at any scans or images, because they can cause more harm if you have an underlying fracture. Otherwise, most acute bouts of back pain, if there hasn't been an injury, are usually usually muscular strain. The pain actually comes from within strain or spasm within the muscles that's secondary to underlying wear and tear that's just been exacerbated. The majority of patients in that scenario will just improve without any intervention whatsoever within a few weeks. However, chiropractors and osteopaths can help speed up that process a little bit with some manipulations, and to prevent it happening again, it's important to take control here of your life, try and improve the health of your spine. That's where I think a physiotherapist can come quite in handy. Once you're acute of that acute severe bout of pain, I think seeing a physio to teach you some strengthening exercise that we discussed is very helpful in the long term and to help prevent a recurrence of that. If you've developed pain, numbness or weakness in the legs, that's a sign of nerves being trapped. There are different causes of this. Mechanically, most of the time it can be either a slip disc or narrowing of the spine, what we call stenosis. I've done a separate video on that, where the nerves get trapped, and there are different patterns to this. If you don't have any weakness in the leg and maybe just a bit of numbness, again, the majority of patients do improve within a few weeks. And it's the same thing, provided you don't have any weakness or any neurological symptoms like numbness, then manipulations or adjustments from your osteopath or chiropractor can be helpful. Physiotherapists can also do some of these manipulations, and then there are some strengthening exercises you can do thereafter. Where I'd be cautious is if you develop either weakness in your legs, numbness in the saddle region in your private areas, or any difficulty passing urine, any of these sort of features, then I think you need to be scanned as soon as possible, very urgently. That's when the nerves are in a bit of trouble and need help. That might need decompressive surgery. So you may have heard of called equine syndrome, which is usually pain in both legs, numbness down below, and difficulty passing urine or even incontinence. That's a medical emergency and that needs urgent medical attention. If a medical assessment suggests you may have called equine syndrome, that usually involves an urgent MRI scan on the same day, and if that confirms compression of all of the nerves that go to your bladder, bowel, and your legs, then that's an emergency operation that's required to remove that compression. Now I want to talk about some underlying conditions of the spine. So there are conditions that affect the quality of your bones, specifically their density, such as osteoporosis and osteopenia. I've done a separate video on that, which make you a bit more prone to fractures. So you can get acute back pain, quite sudden back pain that comes on after a very trivial incident like lifting something and straining your back, or a very trivial fall can cause this. If you're known to have underlying osteoporosis, we can get acute back pain. If over time you notice that your back is starting to arch forwards gradually, that's one of the causes. It's more common in the slightly older population, and in this scenario, if you've got that, if you're known to have that underlying condition, I'd probably avoid doing any manipulations from a chiropractor, osteopath, or physio even to your spine until you've had a scan to show the fracture. And it's worth proving the diagnosis with a DEXA scan, a bone density scan, which can confirm the diagnosis of underlying osteoporosis. Most of these fractures do improve, about 84 to 86% of them improve within a few weeks in terms of the symptoms. If symptoms persist, there are procedures a spine surgeon can do, like myself, where we can inject cement into the bones to harden them, but also equally treatment from your rheumatologist with medications to help strengthen the bones are also vital in the long term. There are also infections that can enter the spine, so into the disc space itself, and they're quite difficult to treat because the disc space doesn't really have a blood supply where antibiotics or your immune system can actually get to it. So patients tend to get chronic pain from this that just gets worse and worse. It can be associated with night fevers. There's usually a previous infection that predisposes you to that. Maybe you've had some dental work done, maybe you've had infective endocarditis, or even another infection somewhere in your body like a urinary tract infection, and then this comes on sometimes afterwards. So if you've had a recent infection of some sort, you've got back pain that's just getting worse and worse, persisting fever, it's worth getting a scan of that and therefore worth seeing your doctor or even your spine surgeon. And then we've got cancers that can spread to the spine. The majority of cancers you find in the spine have actually come from elsewhere. So in terms of underlying conditions, if you are a cancer sufferer and you start to develop back pain, it's very important to get that scanned as soon as possible so that it can be diagnosed. Depending on the amount of spread, there are things that can be done with that to at least alleviate the symptoms or help prevent the spread. And sometimes the initial diagnosis of a new cancer has actually come from patients who've presented with back pain, and that's when the original cancer from another organ ends up being found afterwards when they're being screened. So if you've got back pain that's persisting and getting worse, it's worse at night when you're lying on your back, wakes you up in the night, and at the same time you've been a bit unwell otherwise, you're losing weight, that's something to get checked out quickly with your doctor. The infections and the cancers overall are very rare causes of back pain, and even if you are being checked out for these when there's a concern there, most of the time the tests are negative, but nonetheless it's important to be cautious around these things. So in summary, the majority of causes of back pain are not serious, they're quite benign, and don't need any invasive treatment. Even in the context of sciatica or pain going down one of your legs, that will settle down within a few weeks in the majority of patients. So, in sciatica, without any neurological deficits like weakness or numbness, or if you've just got back pain that's come on, a practitioner such as a physiotherapist, osteopath, or chiropractor can help with that. The acute phase, when it's quite severe, there are manipulations, adjustments that can be done by osteopaths or chiropractors that can help with that. But I think in terms of long-term maintenance of your spine, keeping a strong core, this is where a physiotherapist is quite handy. If you've got sciatica that isn't improving, you've had an accident and caused it, or you've got any of the underlying conditions we mentioned above, or any neurological deficits such as weakness in the legs, bladder problems that we've discussed earlier, that's when you need medical attention. That's often where a spine surgeon can help. And that's because these are the types of conditions where a scan is needed, and that's something usually the spine surgeon will have better access to, not just in terms of ordering it or requesting it, but actually understanding the report and being able to interpret the images ourselves. So whilst a radiologist does a report, a spine surgeon is someone who should be able to interpret an MRI and the images for themselves in context to what they often find in an operation, have kind of a better understanding of what it all means and how to tie it all together. I hope you found this video helpful. The Spine MDT is the only sort of network organisation where we've got all of the different professions of spine care, osteopaths, chiropractors, physiotherapists, spine specialists, and all working together under the oversight of a surgeon, so that we can ensure you're seen by the right person. And our collective goal is to get to the diagnosis quickly, but find the least invasive solution that gives you the longest lasting result. And we're able to do that because of the network of people we have. Visit our website to find out more, or feel free to email us or fill in the inquiry page on the website. Equally, you can call us and we're very happy to help you. Thank you.